Hello, my name's Charlie Lees. I'm a gastroenterologist in the Edinburgh IBD unit, where my goal is to improve outcomes for people living with inflammatory bowel disease. Crohn's disease and ulcerative colitis are the two common forms of inflammatory bowel disease. We don't fully understand why they are caused, but we understand that there's an interplay between genetics, the microbiome, and the environment. Altogether now, about 1 in 100 people are living with inflammatory bowel disease in the Western world. It mostly affects young people. Here are the data that we've generated in Edinburgh, and you can see that at diagnosis, people are typically in their teenage years or young adults, although it can affect people at any stage of life. Currently, we have calculated that 1 in 125 people, or 0.8% of the population, is living with inflammatory bowel disease. But this is projected to rise to over 1% within a decade. In the Western world, this is because the incidence, albeit stable, is 5 times higher than the mortality with inflammatory bowel disease. So we have this phase of compounding prevalence. In the developing world, as countries industrialize, we're seeing a rapid acceleration in incidence at the core of what's going on. So what's happening and what's been happening over the last 50 years? Well, before 1960, you could see inflammatory bowel disease just in Northern Europe and North America, but increasingly it's emerging across the world, and now we see it in great numbers in the Far East, the Middle East, South America, the African and Indian subcontinents. So what's going on? Well, I've mentioned already that genetics, the microbiome, and the environment are all important. And probably all three are needed for this dysregulation of the mucosal immune system that happens in the context of the billions of the bacteria that live inside our guts. The genetics of inflammatory bowel disease has been staggeringly successful in delineating the architecture of the genetic abnormalities, totaling about 300 areas of the genome that are associated with susceptibility to either Crohn's disease or ulcerative colitis, or most commonly both. Many of these genetic links associate with drug targets, including integrins, for example with vedolizumab, and IL-12, IL-23, JAK-STAT signaling pathways, for example with ustekinumab, risankizumab, for tofacitinib, upadacitinib, and other small molecules. A lot of interest recently has focused on the environment because that's probably driving the acceleration in incidence around the world. And sure, diet looks to be very important, but there are many other factors, including hygiene, antibiotics, smoking, stress, exercise, travel, vitamin D, for example, that all seem to be important. And at the core of all of this is a dysbiosis of the gut microbiome. We don't fully understand how much of this is causal and how much of this is associated with the inflammation that's already present. And this is one of the key missions to unpick in future years. When we can truly understand all of this and piece it together in great detail, we'll get a much better understanding of why people get inflammatory bowel disease, and that will then help us to have more targeted therapies and a more precise measure of who needs what treatment when and who will have what kind of disease course when. So thanks for listening to me today. I'll be back with more details very soon. Please tune in, subscribe, hit the notification bell to get all of the updates.